Have you seen quantifiable results from providers that have been using HealthPort's solutions, that they're able to, I mean, I know that the RACs are only active in a few states right now, but have there been instances that you've...
Well, our beta site was one that was active during the demonstration period. So although they didn't use it during the demonstration period, it's my understanding that they've gone back in and put in some of the cases that happened during the demonstration. So I think they're still kind of analyzing it though to see what the system really found based on what they put into it. But I think right now there really is no quantifiable until people really start getting into the process, especially the appeals process, which even the ones that are starting to get requests now, the appeals process, that's not going to happen for at least 3-4 months down the road.
And are you targeting a specific size of provider? I know that small practices aren't necessarily immune to an audit.
Right. Not really. I mean, we're talking to all kinds of healthcare facilities. I mean, even to nursing homes, hospice providers, home health agencies, even the physicians, individual physicians. So we're not really, I think the way they're going to handle it may be a little different, because in smaller organizations, the people that need to be involved, it's usually maybe one person that would handle 2 or 3 of the roles in a larger organization. So I think that it just may be a smaller team, a smaller unit that's focusing on RAC. And smaller facilities, they may actually be able to use Excel access unit tools that are readily available instead of having to really use something more robust, because it's something they can keep on top of better, because they're probably not going to get the volume that larger facilities would. It's really a streamlined process, especially if they're, if they have our revenue cycle management solution, because they've got the claim there, the remittance comes in, they have a table that indicates the codes that are going to trigger this process. So they see a code that comes in that's requesting medical records, it automatically fires off the request to our release of information system. And then our release of information staff will do the processing and mail it out. And it's all trackable, so they can go in and see when the records were requested, when they were sent out, and be able to follow up accordingly.
So would you make the argument that having assessment tools and things that can vary for a RAC audit should be high priority for these institutions?
Definitely.
Even in light of the...
Yeah, definitely, because if they don't know what their risk is, and if they don't plan for that, if they don't have financial reserves, I mean, they run the risk of having a lot of money taken away.